Core Determinants of Health. My name is Vanessa Cowles. This presentation will review the core determinants of health and explain which of the core determinants of health have the most impact on the health of children aged 5 to 11 years old. We will begin by reviewing the core determinants of health. Health services are those services that are available to and accessible by the community, in their community, or in a very close surrounding community. Employment/working conditions are those that a person faces while at their place of work. This can also include the lack of employment as well as the employment status. Education and literacy refer to the level of education and literacy of the community or the population, as well as a lack of education and a lack of literacy. Physical environment is the environment where the community or population is living in. This includes the housing conditions as well as the environmental conditions. Social support networks are those that are available to the community in the form of school counselors, social workers, and public health nurses within the community. This also includes access to psychological counseling as well as psychological treatments. Personal health practices and coping skills refer to the individuals within the community and how each one sees health and copes with stressors. Social environments are the environments where the community or population gathers socially. These can be parks or recreation activities, sports activities, and they can be formal or informal. Child health development refers to the physical and emotional development of the children within the community, as well as the development status as a child of the adults living in the community. Biology and genetic endowment are biological determinants that cannot be changed or modified in the individuals in the community. The public health nurse needs to be aware of the biological and genetic composition of the community when performing a community education program to ensure that the material will be unbiased and comprehensible by the community. Culture is another biological determinant that the community health nurse needs to be aware of. The culture of the community or population will help guide the public health nurse to provide education that is culturally sensitive. The financial and social status of the community refers to the socioeconomic class that the community is in. If the community health nurse is performing an education session in a low or lower middle class community where some may not have adequate health insurance, the education should have information on clinics that are available. Gender is a biological determinant that the public health nurse needs to be aware of. Gender is fluid and not only boy or girl. When referring to the community during a community education program, using the terms ladies, gentlemen, boys, girls may make some in the audience uncomfortable. While all core determinants of health impact children from 5 to 11 years old, the following are the ones which have the greatest impact on the health of the children in this age group. Health services. Children should have access to emergency and preventative health care within their community. Employment and working conditions. The employment status of a child's parent or guardian has an impact on how the child will grow and develop, as well as a lack of employment for these children as well. Education and literacy. The children in the community, regardless of socioeconomic status, should all have an education that is suited to their age, developmental, and grade level. Physical environment. Children should be living and playing in an environment that is safe and clean. The environment should also be one that encourages appropriate development of the child. Social support networks and social environments. The children should have social support in the community. Without a strong social support network, the child's emotional development could be compromised. Healthy child development. This is a big one for this age group. Without a strong social support and access to preventative and emergency health care, the child at this age group may not develop appropriately.